Hi, everyone. Welcome and thank you for joining us today. My name is Kelia O'Malley. I'm an assistant professor with the nutrition program at the Celia Scott Weatherhead School of Public Health. I'm also the associate director for the HRSA-funded Tulane MCH Nutrition Leadership Training Program and the USDA-funded Louisiana Collaborative for Diversity in Nutrition. We're proud to host this webinar in partnership with the Tulane Undergraduate Public Health Nutrition Program. We're thrilled to have 3 public health practitioners with us today who will be able to share a bit about what drew them to the public health nutrition field, as well as the diverse range of careers that exist. We will take all questions at the end of the presentations during a 15-minute question and answer period. You're welcome to ask a question at any point during the webinar by entering it into the Q&A box at the bottom of your screen. The recorded webinar will be made available after the end of today's live session and will be shared with everyone who pre-registered for today's event. A survey link will be distributed at the end of the Q&A session. Please take a moment to complete the short but very important questionnaire that helps us evaluate our work and improve future webinar offerings. Now I'd like to introduce a couple of folks from our team who will be providing additional logistical support today. Lauren Futrell-Dunaway is a registered dietitian and assistant professor in the CSW SPHTM Undergraduate Public Health Studies program. She's currently working to expand nutrition courses and degree offerings that include a newly launched public health nutrition minor. She will be supporting timekeeping today. Megan Harrington is Senior Nutrition Program Manager and will be monitoring the chat and providing general Zoom support. Alexander Mack is a first-year MSPH nutrition student at Tulane and a HRSA-funded MCH Nutrition Leadership trainee who will be monitoring the chat and Q&A box. Finally, the moderator for our panel session today is Eleanor Simon. Eleanor is a first-year MSPH nutrition student at Tulane and also a HRSA-funded MCH Nutrition Leadership trainee. Please join me in welcoming Eleanor, who will introduce our panelists today.
Thank you, Dr. O'Malley. Our first panelist is Casey Shy. Casey is a dedicated public health professional with over a decade of experience in community health program development and implementation, focusing on nutrition education and food equity. Her work addresses health disparities through innovative education programs and initiatives to improve access to nutritious food across diverse populations. Casey's passion for public health is driven by her commitment to continuous learning and community service, as she strives to be a valuable resource in the fight against food-related inequities. Our next panelist is Jacob French. Jacob is currently a community health and engagement consultant at UNC Health in Raleigh, North Carolina. Jacob was a Peace Corps volunteer in Namibia, which afforded them an introduction to public health. After their service, Jacob made the decision to acquire their Master of Public Health from Tulane University. With equity work at the center of all their graduate school courses, internships, and assistantships, Jacob chose to pursue a path in health equity following graduation. A fun fact about Jacob is that they volunteer as a crisis counselor at the Trevor Project. Our third panelist is Adrienne Mundorf. Adrienne is a health equity director for the United Healthcare Community Plan of Ohio. In this role, she leads the health equity strategy, including clinical and population health interventions to reduce health disparities and expand culturally and linguistically appropriate services, programs, and partnerships that address social drivers of health and community engagement to foster collaboration to improve community health. Prior to joining United Healthcare, Adrienne served as Vice President of Programs and Strategy at the Sisters of Charity Foundation of Cleveland, where she was instrumental in establishing a health equity grant-making focus area and an integrated approach to advance a place-based two-generation initiative. Adrienne also worked at Tulane University, where she served in a dual role as Senior Program Manager of the Global Community Health and Behavioral Sciences Department and as Policy and Advocacy Manager at the Tulane Prevention Research Center. There, she published research on evidence-based strategies to improve health, led a local food policy council to improve equitable access to healthy food, and supported grant-funded projects related to domestic and international healthy food access. She holds a Master of Public Health from the School of Public Health and Tropical Medicine at Tulane University and a Bachelor of Arts in Political Science from Kalamazoo College. She is a returned Peace Corps volunteer from Malawi in 2002 to 2005, where she developed a passion for promoting social justice and addressing the social determinants of health. Adrienne is a cancer survivor, and her personal experience navigating the healthcare system has fueled her passion for health equity. Our first question today is, what drew you in general to public health and more specifically to public health nutrition? Maybe we could start off with Casey.
Yeah, sure. I'm like a long-winded talker, so I'll try to be short. So I started my public health degree in undergrad, but I initially was a pre-health professional major. So I was getting a public health degree, but had plans to be doing physical therapy or occupational therapy. But in school, my senior year, I was taking my capstone class where I was doing my internship, and I had an internship at a hospital system where I was in the marketing department, where I got firsthand experience doing health promotion work. And I really enjoyed it. While I still had a passion to do physical therapy, I was also interested in the health promotion side and what was going on in the hospital setting, to educate patients about, support that the hospital provides beyond just like emergencies. Physical therapy school is very challenging to get into and very competitive. And so I did not get in. And so I was like, okay, well, I'll just try again next year. But in the meantime, I'll go get my public health degree because it was interesting. And I had been volunteering and doing a lot of community work that was related to that, to health promotion and health education, just really being in the community. So that's what kind of led me to my public health work. Early in my career, like right after I finished grad school, I was doing a lot of disease prevention and management, which ultimately includes health education and teaching people how to eat. And so I saw that behaviors can change, but if people don't have access, then they're not going to maintain a behavior. So with that understanding and seeing that every day, I'm like, okay, everybody knows what I'm talking about, but they just don't, there's not a grocery store. So how are they going to do it? So I kind of pivoted and moved to more of an interest and a focus in nutrition to help provide accessibility to people that I was working with. So
Thank you, Casey. Jacob, if you would like to speak next to the first question, what drew you to public health and specifically public health nutrition?
For sure. I actually had no clue what public health was when I was growing up. Growing up in a rural area in North Carolina, that's not something that's on anyone's minds. And then I went to a fairly rural university for my undergrad, and I studied business law. So even there, public health was just not a thing. But I had met someone that was going into Peace Corps while I was in my undergrad. And hearing about their experience in Peace Corps, that made me want to join Peace Corps as well. So I went in as a community economic development volunteer. And in my cohort, we also had health volunteers. And while we were training, we would, separate with business volunteers and health volunteers. And I was watching what the health volunteers were doing in their training. And I was like, wait, I would much rather be doing that than this business work that I'm doing. So just that introduction really made me interested in public health and getting to talk to the folks there, what their backgrounds were. A lot of them had public health degrees already. So following that, I knew that I wanted to go get my master's in public health. And Tulane is a very service-oriented university. So I learned just how much they enjoy having Peace Corps volunteers there. So that's kind of what drew me just to the university and public health in general. For public health nutrition, that was kind of like right when COVID was getting started up in, 2020. And I think a lot of misinformation was going around specifically about nutrition. Everyone was an influencer during that time. You had your nutrition influencers, your bodybuilding influencers, your exercise folks who all wanted to give their piece of information on nutrition, and I was just a little skeptical of the information that they were putting out. So that's kind of what drew me to the nutrition part of public health.
Thank you so much, Jacob. And last but not least, Adrian, if you would like to speak to what drew you to public health and specifically public health nutrition.
Sure. Thanks, Eleanor. And thanks for the opportunity to be here. This feels a little bit like a homecoming, as about a decade of my career was at Tulane. Eleanor spoke about it a little bit in my bio. I had two really pivotal personal experiences that really opened my eyes to disparities around health and specifically around nutrition. I also was in the Peace Corps. I went right after undergraduate where I got a degree in political science. And I was in a country in sub-Saharan Africa, Malawi, at the height of the AIDS epidemic in sub-Saharan Africa. It was also at a time where there was a drought that impacted the country to one of the worst famines that they had seen in decades. So I served as an environmental volunteer, but really started to connect with the women in my village over cooking. And we started swapping recipes and started to really understand that language of communicating through food was so important. And that led to me staying in Malawi a third year, working with an AIDS organization that, so again, height of the AIDS epidemic, but before ARVs and medical therapy were really available to help mitigate the impact of full-blown AIDS. So Malawi and a couple of other countries in Africa were piloting what does it look like to use nutrition as a way to manage this chronic condition and really support healthful living for individuals who are HIV plus. That it was an incredible opportunity to serve and really humbling as well as I, continued to see experiences of food insecurity and families struggling with this disease. So that was a pivotal moment where I was like, wow, there are disparities exist. We need to do something about it. When I went back to the States, I was sort of looking for the first. Peace Corps volunteers don't make a lot of money. So I was sort of looking for the first opportunity I could find and found a job in human resources at an architectural firm where I then saw I was working on employee wellness programs and managing benefits. That's also where I was diagnosed with cancer, spent a year in chemo treatments, and lived in Chicago where I had incredible access to healthcare and lived in a neighborhood where I had food access. I saw differences in Chicago. Studies were starting to come out that were looking at the impacts of redlining and disparities in food access, and knew I wanted to be in that space. Tulane, this was post-Katrina, Tulane and the work in the nutrition department at the School of Public Health were really starting to look at the impacts of post-Katrina and the food environment. So that sort of catapulted my interest in public health nutrition and furthered my adventures after that.
Thank you so much, Adrian. Our next question today is, what did your career path look like and how did you get to your current position and organization? Maybe Jacob, if we could begin with you this time.
For sure. I'm a fairly recent graduate from Tulane. I graduated with my master's in May of 2022. So I would say my career path is a bit short, but equity work, like I said in the bio, equity work is kind of the central focus of all things in my master's degree, whether it be my nutrition courses, my GIS courses, and also equity-based courses. So that was kind of my interest. So following graduation, I really just very non-unique. I was applying to jobs just like everyone else, looking at states that I wanted to live in, scrolling through LinkedIn like everyone else. And I actually landed on a job as a health equity coordinator for Guilford County Department of Public Health, which is in Greensboro, North Carolina. And found that on governmentjobs.com. So again, very non-unique. And I was the only person in the Department of Public Health that was solely focused on health equity work, and that consisted both internally and externally. And if anyone is doing equity work, they know that that is a pretty exhausting field, and it does take a very large team to do that kind of work, and not just one person within a 500 plus person department. So I was a little burnt out after 1 year in that position. So that is how just through that position, I got acquainted more with the different public health entities throughout North Carolina. And I saw the work that UNC Health was doing, which is the hospital system associated with UNC Chapel Hill. So I applied for the job that I currently have there. And as a community health consultant, really my main goal is to build a connection between our hospital systems and the communities that we serve, so that we have a better idea and a holistic care idea when we are treating our patients, and how we can prevent them from even coming into the hospital in the first place.
Thank you very much. Adrian, if you would like to speak next about what your career path has looked like and how you got to your current position and organization.
I referenced it a little bit in my previous comments, but just I think overall my career path has not been a straight line, nor did I really know where I was headed, except that similar to Jacob, centering health equity in any of my positions was really important to me. I graduated from Tulane with my master's in public health in 2011, and ended up getting the opportunity to stay at Tulane, working on that research that I mentioned around food access and food justice, and really had the opportunity to look at work in New Orleans and different environments, school-based environments, retail environments, and really understanding how that, I think Casey alluded to this too, that access to food, you can have all the nutrition education you want, but that access is critical to advancing equity around food and food sovereignty. I also had the opportunity while working at Tulane to work internationally, also on nutrition projects. I worked in Pakistan, looking at school-based community health centers, and as schools as a hub for nutrition and sanitation initiatives in Pakistan after a series of floods and earthquakes impacted access there. And also got the chance to go back to Malawi and implement nutrition education in curriculum in primary schools in Malawi. So that got me, I think I really had the opportunity to work in a diverse set of projects. Family circumstances brought me to Cleveland, Ohio, where I'm currently today. I ended up working at a foundation, a grant-making foundation focused on really addressing addressing poverty from a number of different angles. There I had the chance to lead grant making that focused on social drivers of health and on health equity, and really I think there appreciated the connection and importance of community voice and those with lived expertise in shaping and designing initiatives. And I'll just end by saying that in each of these roles that I've had, I've seen myself as sort of a generalist. I I am not a biostatistician by any means. I'm not an epidemiologist by any means, but the core curriculum at Tulane, including those classes, the social determinants of health courses, courses in health systems, has been really important to helping understand the role of public health in each of these different industries. From the philanthropy role, I was really interested in impacting systems at a larger level. And so now work at United Healthcare, one of the largest health insurance companies, where I focus on working with Medicaid enrollees and working on initiatives that address health disparities within our population. So again, sort of a lot of different industries, but really centered in health equity and remaining open to what's possible as more of a generalist.
Thank you, Adrienne. And lastly, if I could have Casey answer that, what has your career path looked like and how did you end up in your current position with your organization?
Yeah, it's just so funny because Adrienne's like in my brain right now, saying things that I would say also. So I also view myself as like a generalist in the public health space. I did not include this in my bio, but I also did graduate from Tulane. I graduated in 2016. And so my degree is in public health, and I got a certificate also in program management. While I was in school, I took classes in every discipline, right? So I did the core classes, and then in every class, I was like, oh, we're reading this article about HIV. Oh, I'm so interested. And then I'd sign up for an HIV class. Oh, we're reading an article about food. Oh, I'm going to sign up for a food class. So I literally took a class in every discipline area. And including GIS. And I knew that this was not for me, not a skill that I was going to be good at. I learned a lot of things about who I was and what space I wanted to be in. And so from that, in the school setting, I was very involved on campus. And then outside of school, I had lots of jobs, because I felt like, okay, well, I don't want my resume to just say I've been in school for like however many years. I need to have like some kind of like skills. And so I was very involved in the community and volunteering and participating in a lot of spaces just to like learn more. And so when I graduated, I got a job at a place I volunteered for all through grad school, the American Diabetes Association. I started my role there in fundraising, which I quickly learned that I hated. And then a program position opened up, and then I worked in a programmatic role implementing diabetes prevention and management programs for about 5 years. COVID, I got laid off. And then I became my own public health consultant, working with some community medicine doctors in New Orleans, supporting organizations through like shutdown and reopening, and just like educating people on like everything that the CDC was sending out, because it's a lot of information to digest. So I did that work for a while I went back to school to get another bachelor's in food and nutrition. And then I was like, oh, okay, well, I need health insurance, so I guess I'll go get a full-time job and stop being a consultant. And so I then got the role at Market Umbrella. And so I've been with Market Umbrella for over 3-ish, almost 4 years. And our organization has grown pretty quickly in the last 3 years. And so I've had most of my role has been in the programmatic space, but initially I was like overseeing 8 programs. And then now I pretty much oversee all of our federally funded programs. So really what Adrienne said is like really being a generalist and, keeping an open mind was is like my soapbox when it comes to public health. But I would say that, the path that I got here was not planned path, even from like undergrad. And because of my open-mindedness to just be, immersed in the space and like learn, I think that, it's been beneficial, and I've continued to learn lots of things, in all of the roles that I've had. I've learned about grant writing. I've learned more about financials. Yes, I took classes in grad school that were specific to finance and managing programs, but like actually being involved and understanding all the things is a different thing. So yeah, that's pretty much how I got here.
Thank you. Our last question of the day is, what advice can you give to prospective public health and public health nutrition students as they explore their own educational and career paths? And this one, if I could have Adrienne begin.
Sure. I think the context has changed a lot since I graduated, and I think there are even more opportunities to leverage a degree in public health, particularly those with nutrition focus. I think one area that I think we saw a big boom after the Affordable Care Act passed and now is resurging is roles around community health work, and really, again, linking those lived experts with the knowledge of how to navigate a health system and support optimal health. Those roles are popping up everywhere in every industry. I think the health systems are really seeing CHWs as a way to link clinical health to individuals who might have lost trust or be disenfranchised from the systems. United Healthcare employs community health workers as well. There's always positions open for those of you searching. But then also this idea of, well, I guess more broadly, there are clinical work shortages across behavioral health, across specialty focus. You're seeing hospital closures in rural communities. And so those CHWs can help create those linkages. I also think there's a burgeoning role of quality improvement science, which is very similar to the program design and monitoring and evaluation courses that Tulane and other public health programs promote. Really understanding how to set up interventions and working with community and provider partners to try to improve health through quality improvement science. I also think there has been advances in understanding the impact that food has as medicine, and really the role of mitigating chronic disease and managing chronic disease conditions using tailored food interventions. So here at United Healthcare in Ohio, we have medically tailored meals for members with chronic disease conditions and for pregnant people as they to support healthy pregnancies. We also are working with food banks across the state on produce prescription boxes. I know there's some great programs in North Carolina, Jacob, that are also happening. And so there's roles for nutrition, public health nutritionists or public health nutrition backgrounds to really shape those programs and make sure that they're set up with fidelity and seeing the impact that that you want to see. And then I think another role within sort of the managed care and healthcare system is thinking about, so for those of you who are more epi-minded, or health information, thinking about data collection, what kind of food security screener questions are being used, how are they being implemented, how are they being asked, are they being asked with cultural concordance to the individuals that they're serving, and how are they using that information to then direct interventions and support the connection to food access through clinical settings. So I think just like that, in a nutshell, there are so many opportunities. And I guess I would also take a moment to ask yourself, especially if you're on a generalist path, like it sounds like a couple of us are, what brought you to grad school, and has that changed, or to undergrad, has that changed? What's your North Star? What's guiding you towards your next step? And what kind of guardrails do you have about what type of organization, where you might want to live? And really stick to those guardrails, because if you end up in an industry that you had reservations about, you might not like it unless you're someone who's interested in impacting the system from within. And I think consider those questions too. Do you want to be a change maker within systems, or break down and start systems anew. I think those are really important as you think about the type of organization you're looking for. And then once you narrow that down, really seek out connections and networking in those fields, because I think that those connections are really important to those career paths and those movements within your career. And I'll add a couple of links for opportunities at United Healthcare that might be in line with folks in the job seeking mode.
Thank you, Adrian. Next, if I could have Casey speak to any advice that you have for prospective public health and public health nutrition students as they are exploring their educational and career paths.
Yeah, I would echo what Adrian said about, ask yourself what brought you here and, figure out, what you think your plan might be. When I was in school, like while my path was not linear, I know when I was in school, I was strategic about the things that I wanted to do. My why was, okay, well, I thought I was coming here to do this thing, but now I want to leave here and have these skills and have this knowledge and be able to speak to these things, right? And so that's kind of where I was like, okay, well, I'm okay with the generalists, because that means I can go to any interview and speak to all of these skills and basic information that I know related to all of the things. So I would echo that. I would also say, echo about, getting out there and networking and making connections. When I was in grad school, I was in the student government, and we used to tell everybody, your student fees, they pay for career services to help you write a resume. They pay for career services to help you do everything. So please go to career services. So I will tell you, go spend your money that you've already paid to get your resume updated, to get somebody to review it, for them to set up a mock interview with alumni. I mean, I've done it myself. I did it as a student, and I would be happy to give you a mock interview the same way that I interview people and give you feedback about things you can work on. Those skills were a game changer when I left school, and I was like, oh, I have all these interviews, like, oh, I'm nervous, oh, this and that. Like, they literally put me in positions to where I was like, okay, I think I got this. Okay, I know how to speak to this. I know how to address these comments or whatever questions they're asking. So network, use the tools that you have on campus, whatever school you're at, because you're paying for them. The last thing I would say is volunteer. You can learn everything in the classroom and know the book front and back. Those soft skills, critical thinking, problem solving, time management, those are things that you learn by doing them, right? So I would say volunteer, get out in the community and work and do things for different organizations, because that one will allow you to learn about what organizations do, and two will help develop those soft skills that I would say employers are really looking for on top of your actual knowledge. So
Thank you, Casey. And lastly, I will have Jacob answer any advice that you can give to prospective public health and public health nutrition students.
Absolutely. As a recent graduate, I feel like I just have so much advice to give on this. In terms of an educational path, I would definitely echo what Casey said. Volunteering, doing your assistantships, doing all the graduate assistantships you can, whether it be a research assistant or just being a front desk somewhere. These employers want to see that you're doing something else besides just classroom work. They want to see that you're actually experiencing the work that you're learning. So definitely do that. I know that can be intimidating because the classwork is already difficult, and also if you're in Louisiana, you're busy with Mardi Gras, so it can be a lot to juggle. But definitely recommend doing that in the free time that you do have. And taking those internships, as well as your practicum. Be mindful of what your practicum is, and if it is aligning with what you want following just being a student. So I think that's just a very important thing to keep in mind. In terms of career paths, I would say know your worth. Remember, you just got a master's degree or an undergrad degree, whichever, And a lot of people don't want to pay newcomers as well as they should be paid. So I think holding yourself to your standards and not just accepting the first job that you get is absolutely necessary. Make sure you remember your worth. One more thing I would say as far as career paths is being tactical about where you're applying and the geographic areas you're applying in. For instance, like I've said, I'm really big into the equity work. If you're doing that kind of work in a state or a city that is trying to give a lot of pushback on equity work, know that they could potentially be coming for your job soon. So I would be, not to say I think equity work is important everywhere, but also you have to take care of yourself in these situations. So I would just make sure that whatever your North Star is, like Adrian was saying, make sure that the area and the organization that you're going to be a part of is also aligning with that North Star so that you're not out of a position.
Thank you, Jacob.
All right, now it is time for the Q&A. I think one of our students may be monitoring that. If not, I can, there is a question for you. Specifically, Casey, what drove your decision to get that other bachelor's degree?
Yeah, I didn't realize that people were messaging me in the chat. I like opened it up and I'm like, oh, I'll just type in a response. But yeah, so when I was working at the American Diabetes Association, I was doing a lot of like direct education with like small groups, large groups, one-on-one of like what a healthy lifestyle looks like. And you know, I can, as a public health practitioner, I can speak generally, but I'm not a nutritionist or a dietitian. So there's like a scope that I had to stay in. Like I can't tell you that you should eat bread or should not eat bread because you have diabetes and I don't know what your medical situation is. I don't have that knowledge. So that was frustrating to me because people were frustrated that they're asking me a question and I can't answer it. So I decided to go back to school to get my second bachelor's to then proceed to become a registered dietitian. So I got married in March. I have not had time to do the next step of becoming, you know, doing you know, to move towards the registered dietitian step. And so that plan is to move towards that because it's really challenging when you're like in spaces and people have very specific questions and I can't answer them. While yes, I've heard them a million times from a dietitian that I always used to bring with me, but the day that she's not there, I'm like, oh, I can't speak to this, but I can tell you who to call. And that's frustrating for people. And so I just wanted to kind of like eliminate that barrier because I see myself as a resource. So I just felt like I needed to have all the information and be able to answer questions. So
we had another question for everyone about what professional associations do you belong to, both nationally and locally?
I'm gonna have to pull up a list because I can't keep up. I am a part of APHA, the American Public, I can only tell, I live my life in acronyms. I'm a part of APHA, the American Public Health Association. I'm a part of, there's something about nutrition education, Society of Nutrition Education. Then there's like another one that's the Society of Social Behaviors and Nutrition. I presented at a conference. I can send a list, but a lot of them in the work, because we have, I operate grants that are federally funded. I get asked a lot to present at conferences. And so through that, I am part of a lot of organizations because of the work that we do. But in general, since graduating, I've maintained my APHA, which has been a really great resource. They post jobs, they do continued learning, because I also have my CHES. Oh, I am a CHES certified health education specialist. So I've maintained that since I graduated. I mean, those are the main two. I'm also a part of the American Diabetes Association community educators group. And that's just so that I can get educational information for free. But yeah, there's plenty of, the good thing is that my job pays for a lot of these. So they have since I've graduated, I haven't had to pay for them because they are generally all related to my work. So if you're interested in an organization, when you get out of school, like try to get your job to pay for it, especially because you usually get a discounted rate as a new or recently graduating professional or whatever. So
Jacob, did you want to add to what associations you're a member of?
For sure. I'm actually not a part of any national associations, but I am involved in a lot of more local professional orgs. So I would highly encourage people doing that as well. Building your resume, you get to know people. It can help with searching for jobs, and also it's just good to give back to your community in that sort of way. But I'm a part of the Guilford Anti-Racism Alliance, which does anti-racism work in Guilford County, which is where Greensboro is located in North Carolina. Also part of the Greensboro Health Disparities Collaborative. They do exactly what the name says, specific to Greensboro. And also part of the White Messaging Campaign, which is an organization that teaches white folks how to talk to other white folks about racism and anti-racism. So that you're not pushing people away and trying to bring them in instead of call them out. So highly recommend doing some of your local orgs.
Thank you for adding that. I think sometimes we forget those, and they can be sometimes just as much as or even more impactful for connecting with the communities that you're working with. Adrian, did you want to share your professional organization list or local?
Yeah, I think Casey and Jacob both earlier talked about the importance of volunteering, and I have board service on a couple of nonprofit organizations. Health Policy Institute of Ohio puts out rankings in Ohio across a number of health and cost variables, and I think that's been really helpful to shaping the policy landscape here in Ohio. Similar to Jacob, so I participated in a number of trainings to the People's Institute for Survival and Beyond in New Orleans, and oh my gosh, the name is escaping me, but it's in North Carolina, the racial equity organization that puts on these incredible groundwater trainings. And then, finding ways to be part of work groups and organizations or boards to sort of build the systems change. I'm participating in a health-related social needs work group right now to look at how in Ohio, and again, North Carolina has passed this, but Medicaid reimbursement can cover costs for nutrition services in the community, right? So those really participating and bringing my own experiences and knowledge to spaces to make change at the system level has been really important. But and then, thank you, Racial Equity Institute. Yes, they've come to Cleveland a number of times. Also looking at fellowship opportunities, American Express has a fantastic social justice leadership fellowship that was really important for me for networking and connecting and understanding how social justice work might look in different communities. And even if it feels like an uphill battle, to Jacob's point, identifying those allies and opportunities to impact in any way possible.
That was great. Thank you. We had a really thoughtful question in the chat. So all of you got your MPH at Tulane, correct? Yay, nay, yes, I'm seeing nods because it says who got your MPH at Tulane. The question was, what degree did you get, and would you say it was the right degree? And I'm going to add a bonus question to that because I talk a lot with students about how we may be interested in nutrition as a subject, but it's skills are what gets us jobs. So Adrian, I'm going to let you go first. So do you feel like you got the right MPH? What MPH did you get? And I'm adding to that, like, what would you say are the top 2 or 3 skills that you feel like you use in your job now that you can directly see a connection with that degree?
Oh, great question. So I am not an RD. I did not do the dietetics program. I think the program that I did in 2011 doesn't exist, but it was there's iterations of it. It was in the public health school, community health nutrition. And I sort of did a combination of domestic focused and international focused coursework. I think I'll go back to some of those core. I would say that epidemiology, taking some of the advanced epidemiology courses, were some of the hardest courses that I ever took, and they are so important to understanding how to look at data, understand data, and share the key messages that come from that data, telling the story about the impact that an intervention can make, or about a population and the disparities that the population might face. So if epi makes you cringe, I think it was just so foundational. And then I probably took it for granted at the time, because I don't know that I saw myself in the health systems field, but I think the health systems and policy management courses were really helpful to understanding the macro. And again, what are the levers that are facilitating advancing health equity, and what are the levers that might be preventing equitable health and nutrition access. So I think those two would be courses that, I don't know, I think that's where I gained some skills and that I use every day.
That's really helpful. Thank you. Casey, how would you answer that? Do you feel like you got the right MPH? And then what skill sets do you feel like you're using today? And I'm tag teaming your other answer, because I'm gonna ask you about your bachelor's, and you're like, why'd you go to another bachelor's? That was for a specific skill set, because you're like, it was on the pathway to the RD. So just kind of tying that in. But what do you feel like you use from your MPH?
Tulane is really good for changing the department names. So I don't know what the department is named this week, but when I was in school, it was called global behavior, I don't know, GCH. I live my life in acronyms. GCHB, which was like the community, international health, all those people who did nutrition. I think I looked up what the degree is titled now. I think my degree is in community health, which was like more of the general degree that kind of allowed for me to take classes in maternal and child health, HIV, nutrition, program development, evaluation, all of that. But I think that is now called social, behavioral, and population sciences. I also was the first, apparently, the first student to graduate with a program management certificate, which I also understand also does not exist anymore. But I will say that I do feel like I got the right degree. I initially came to Tulane, applied, and was planning to do the healthcare administration. And then when I realized, I was like, oh yeah, no, this seems like a lot of paperwork. I like people. But I do feel like I got the right degree. I think that the skills that I learned, a lot of the skills, my undergrad degree is in community health also. So a lot of things I kind of already knew, I just kind of was able to expand upon. But in the certificate program, I really learned a lot about like managing a program, like managing a budget, reporting, like a lot of the skills that I use every day. I would say I learned while I was in school, just like basic knowledge of administrative work, because yes, the community is great, but there is an administrative side that you have to maintain. So I would say if you are not, and if you're interested in doing a certificate, you should learn great things there. Oh, what was the third question about?
You're good. I'm going to come back to
Okay,
you.
good.
I'm going to
Oh, yeah.
I'm gonna call an audible question for Jacob, and I promise it's not hard. But we had a question that came in anonymously about just like, what does it look like to be a consultant versus the job you had before? I know several of you are consultants, but Jacob, what does it look like for you to be a consultant versus what your first job looked like, working for a specific program?
For my first job was health equity coordinator, so I felt a little more involved with the community aspect and being face to face with the community members and the other community organizations doing the work. As a consultant, I feel I'm a consultant in the healthcare field. So I'm working more with our hospitals. UNC Chapel Hill has I believe it's 17 hospitals across the state. So I'm working more with our hospitals and kind of consulting with them how they can do better at building those community relationships. So it is, I mean, I do still in part of the meetings where you're directly meeting with the community members. But after kind of establishing that relationship between the hospital system and the community member, I'm a bit more hands-off.
And I have one more follow-up question for that. Did you apply for the role as a consultant or did you pitch the role to be a consultant?
I applied for the role.
Okay, so that's because sometimes I think that's a question that students have, like sometimes it's like a posted role to be a consultant, and then sometimes consultant means that you do it from your end. That kind of sounds like Casey, what you did, like you were kind of
Yeah, that's what I did for my end. Yeah, I pitched what our plan was going to be.
Yeah. Just a little shout out for anyone applying for jobs. Chapel Hill does have those consultant positions within the healthcare system, and there are some health equity quality improvement consultant positions open right now. So you can just go to UNC Health's website to find those.
Thank you so much. Thank you. Sorry about my voice. Thank you again to all of our panelists and sponsors and participants who joined today and those that are going to watch the recording. A quick reminder that if you did pre-register, their session will be shared by the end of the day today by email. And please take a moment and in a few minutes on our last slide, there's going to be a short but important questionnaire that we will have. There's going to be a QR code and a link to do that. And the links are also going to pop up in the chat. So we have some exciting events coming up that I'm going to end our time with today. I'm excited to announce our first nutrition book club. This is going to be our first public health nutrition book club. Is a joint effort between the undergraduate public health studies program and Tulane Nutrition Downtown. And we are going to be reading Live Nourished, Make Peace with Food, Banish Body Shame, and Reclaim Joy by Shauna Spence. Shauna is known on Instagram as the Nutrition Tea, and she does an excellent job of capturing the nuance of topics like diet culture, intuitive eating, health at any size within a public health framework. I also really like how she's not afraid to tackle tough topics like capitalism, racism, as they relate to nutrition and food systems. We do have copies of the book available. The number differs for Tulane students, for graduate students and undergraduate students. Please email bsphnutrition@tulane.edu to sign up. And there's going to be opportunities to meet. It's this semester. There's going to be opportunities to meet in person as well as online, and we will get the schedule together once we know who's going to participate. There's also two more exciting events I want to tell you about that we will show you on the next slide. We are going to do another one of these webinars. We're going to do another one in November, and it's going to be a panel on careers in public health nutrition with a wonderful new set of panelists. And thank you so much again today for those of you that shared your time. I know that time is incredibly valuable. We're also really excited before that on Thursday, October 10th. There is going to be a symposium on green infrastructure, food systems, and building climate resilience in New Orleans. It's going to take place between 2 and 5 p.m. And there'll be a series of speakers highlighting conversations on next steps for incorporating food productive green infrastructure in the greater New Orleans area. So you'll be able to join that either remotely or in person. And you can use the QR code on the screen, or you can use the link in the chat as well to register. So thank you everyone again for joining us today. We hope that this is the first of many times together to just take a deeper dive into public health nutrition. And I hope that you have a wonderful rest of your week. Thank you. And don't forget to do the evaluation. Thank you.